When you think about Addison's disease, don't think just about sodium and sodium and potassium ratio. There is a lot more to Addison's disease than just this classical presentation. Dogs with Addison's disease can sometimes present with just gastrointestinal signs. Sometimes they look like dogs that have protein-losing enteropathy. Sometimes they come in with just megaesophagus. So it's important to remember that there are all these other presentations. Again, not just sodium and potassium abnormalities and the consequences of those. The other thing about Addison's is that you really want to screen those patients as much as possible, even if your index of suspicion is not very high. And probably the best test we have so far for screening dogs with Addison's is the baseline cortisol, which is relatively quick, inexpensive, and readily available. If your baseline cortisol is high, or at least high normal, then it is very unlikely that the dog has Addison's disease. So it's a very useful test for ruling out Addison's. If baseline cortisol is low, you still need to do an ACTH stimulation test, but you would do a lot less ACTH stimulation tests on dogs that do not have Addison's by running baseline cortisols. And you would do a lot more ACTH stims on dogs that do have Addison's if you run baseline cortisols.